Our next guest says neuropathy responds to what a person does, whether it's good or bad. Neuropathy patients can help themselves by watching what they eat, remaining active, and managing their symptoms. He's Dr. Matt Thomas, board certified in neuropathy and the founder of 360 Neuropathy, and he joins me to share more. Hello, Dr. Thomas. Thank you so much for being here.
Hi, Hannah. Thanks for having me on Good Morning Texas, Ian. It's great to be here.
Of course, we love having you here. And Dr. Thomas, people have become more health conscious, I think, in the recent years. Can you talk to us about how a person's lifestyle can affect neuropathy?
You know, I agree. People have become more health conscious over the years. And really, when you think about your health, you're never stationary. You're either headed towards sickness and disease, or you're headed towards health and wellness. And your lifestyle plays such a huge role in that. Now, whether that's good sleeping habits, making sure that you're eating the right foods and taking care of your body, exercising, all of these things play a huge role in moving you towards health and wellness. I mean, take a diabetic, for instance. They constantly have to monitor their blood sugar to make sure they're at acceptable levels as part of a lifestyle. So people who have neuropathy, it's so important to make sure that they're not smoking, not drinking excessively, they're exercising, they're getting good sleep and managing their stress. All of these things play a pivotal role in them being able to manage their condition.
What I think is so key here, these are all choices that we all make every day, so it puts us in a position of power. You know, as a part of a healthy lifestyle, people who have been on prescribed medication for the neuropathy may be looking to end their use of drugs. Are there options?
And there are other options, and you know, with pain medications and prescription drugs, unfortunately, they don't do anything but mask and manage the symptoms. They're not good for long term, especially when we're talking about improving your health. And there are other options to make sure that you can reverse this process. Now, neuropathy is a condition that is progressive, okay? So it will only get worse over time. But there are several things that can happen. Now, number one, you've got to stimulate the nerves to grow because the nerves are dying. Number two, you've got to increase blood flow. If you don't get oxygen and nutrients down into the nerves via the arteries, you're not giving the body what it needs. And then nutritionally, as we talked about before, that's where lifestyle plays a huge role. The nerves will not regenerate and grow unless you actually give them what they need to heal.
You know, doctor, one thing we've talked about, a lot of times people don't realize what they're experiencing is neuropathy. So people that are experiencing chronic pain or they suffer from that, could that be neuropathy?
Absolutely. I mean, chronic pain could be the result of several conditions, one of which is neuropathy. If someone's experiencing numbness, tingling, burning sensations, electric shock-like pain, or muscle weakness, especially in the arms and hands or legs and feet, this could be neuropathy. But it is so important to be evaluated early, because if you let this thing get bad enough and you get past a certain point, it can become irreversible. But if you make sure to get seen early enough, then it can be taken care of.
So that leads me to what you and your team do. Let's talk about what 360 Neuropathy does when a person who is suffering from neuropathy comes in. What happens?
Well, first of all, it's very important to get an accurate diagnosis. Most people who have neuropathy have never been diagnosed accurately, so we want to make sure that we do a thorough evaluation and examination process to make sure that we're recommending the right things for people. Everything we do and everything we have in our office is FDA cleared, it's non-surgical, we don't use any injections or anything in our office. We want to make sure that we're recommending the right things for people because we realize that not everyone is the same. So we can't take a cookie cutter approach to resolving these issues. We have to make sure that we're looking at the patient as an individual because there are many different causes, there are many different levels of severity, and we need to make sure that we're giving each patient the best possible care.
I think that customization is so key, especially when it comes to health. Now, really